Hey, Brian here with Photonic Health. We're here today to take a look at a dog and how to do a basic assessment on him. And we're going to keep this very, very basic so you guys can learn how to do this yourself and check your dogs out at home. And then what the cool thing is where you find any issue, that's where you're going to put your red light. And the issues we're going to see is we might see some flinching, we might see where they turn like they're going to bite you. Most of your friendly dogs won't bite you, but if it's somebody you don't know, make sure you put a muzzle on them first so that way you don't get bit. My little dog that I'm going to be borrowing right here or using right now is Shelby. She's our 15-pound mix, and she's about 10 months old, so we want to know is how she's doing. So what I'm going to do is take my fingers, and I'm going to put them about a ½ inch on each side of her vertebrae. And I'm going to start on each side and just slightly pinch as I'm going along. And I'll keep one hand underneath her just to keep her here. And I'll turn her a little bit so you can see her this way. And I'm going to go down. And they might squirm a little bit, the dogs. And as you're pinching along, and I just pinch and push. And when we get to the back, she might react a little. Oh, there it is. So we got something going on right above the hip. And then we're going to follow with our fingers and just push down along her, what's called her scapula, down to her legs. And she licks a little bit on my right side there. And then I'm just going to squeeze slightly as I go down and make sure that everything is okay on her paws. And she's not making any, oh, she's a little reactive there, so we might check something there. And then I'm going to turn her around so you guys can see. And we're just going to check the back hips. And we're going to work the same way down, going all the way down to her leg. And you can see we had a little bit reaction on that spot. And that's how we do it. So, to recap, what we do is we feel along the spine, all the way along, and we push as we go down the side of the front legs, all the way down to the paws, and then do the same thing in the back. We're just going to feel the bones and just go all the way along and see if we get any reactions. Oh, she's doing a great job setting up. Good job, Shelby. And that's how you do a basic assessment on a dog.